Welcome in. Gonna give like a couple seconds and then I'm just gonna jump right into it. Today we're talking about myths and facts of STIs. All right, gonna jump in. So, y'all have seen me before, but in case you haven't, my name is Monique, pronouns she, her, hers, and I am the Community Health Coordinator here at Whitman-Walker Health. Also, if you've been here before, you know that there are some housekeeping rules, so I'm just going to read them off to you, okay? So, Whitman-Walker Health's Community Health Department has expanded its outreach efforts to the social media platform, hence Instagram. We cover various topics about HIV, STI, sexual health practices, access to care, social determinant of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. My last few lives have been about COVID-19. I thought y'all needed a break, so we're not gonna talk about COVID today. Even though it is still around and it'll probably be for a while, we're not talking about it today. So, during my time working with young people, I've heard many myths about STIs, either that they've heard, that their friends told them, that they told their friends, and as I've learned, young people tend to trust what their peers tell them versus what they hear from trusted adults. So I asked around for some myths about STIs so that I can provide facts, not only from young people within the 13 to 24-year-old demographic, but also from folks my age who are in their 30s who have also heard or believed these things when they were younger. So if you have any myths, go ahead and drop them in the chat, and I will do my best to fact check them, or we can fact check them together. So I think it's important before we start to differentiate between STIs and STDs. So those two terms are used interchangeably. However, we already know we already know that ST stands for sexually transmitted, but the I stands for infection, which are curable, and the D stands for disease, which are treatable but not curable. What my doctor told me when I was growing up, when I was a teenager, that anything with the H was a disease and incurable. Treatable, but incurable. So that's how I remembered it. And we at Whitman-Walker Health test for the most two common STIs. So those are infections that are curable. And HIV starts with the H, which is treatable, uncurable, for free. And we also provide treatment for both. So, on to the myths. I have about 15, so I'm going to read them off and then I'll fact check them. So, first myth is you can see an STI if your partner has one. So, clearly a myth. While common symptoms of a sexually transmitted infection include vaginal discharge, sores around your genitals, painful intercourse, and itchiness, you or your partner can have and transmit an STI without actually exhibiting any signs or symptoms at all. Actually, the most common symptom is to not have any symptoms at all. That's why it's important to get tested. We say to get tested for STIs every 3 months. Now, myth 2. You can't get an STI if you've only had oral sex. Absolutely false. Absolutely false. So, fact check. I think it's important to note that oral is a form of sex. I think young people think that because there's no penetration or no insertion involved, that oral does not count as sex. It is absolutely a form of sex. So is anal. So, with that being said, STIs are easily spread through all forms of sex, vaginal, anal, and oral. The infections are caused by bacteria or a virus that can enter the body through tiny cuts, tears in skin and mucous membranes. Okay, so you absolutely can contract an STI via oral. Third myth: a condom protects you from getting an STI. So I don't really want to call this, I don't want to say it's like a myth, but it is a myth, but it's kind of not. Anyway, the fact is, a condom can help lower your risk, but is not foolproof because they don't always completely cover infected areas, or they can rip or break. Don't count only on a condom for protection from an STI. Myth number 4. You can get an STI from a public toilet. This one I've heard young people tell me 1,000 times at minimum. You absolutely cannot, thankfully, get an STI from a public toilet. You can't. First things first, you shouldn't be sitting on public toilets, but I know sometimes things slip, you forget, you really have to go and you just plop down. But thankfully, that is untrue. STIs require a warm body to live and will die outside of that environment. While it is important to have good hygiene, especially in public restrooms, sexually transmitted infections are spread from person to person, not from toilets to other surfaces. All right, myth number 5, an STI resolves on its own. It absolutely does not. Unfortunately, STIs will not go away on their own. There are long-term side effects and health risks that accompany STIs, such as becoming sterile, meaning that you would not be able to have children if you've had it for a long time. So they do not go away on their own. And remember, I mentioned earlier that the most common symptom of a STI is not to have any symptoms at all. So we absolutely encourage you, if you are sexually active, to be tested every 3 months. Next myth: I am unlikely to get a sexually transmitted infection. So this is another one that I don't want to say is a myth, but it's also not fact. The fact is, STIs are very common. Many have only mild symptoms. Few have no symptoms. Well, many have only mild, few, or no symptoms. That's what I should have said. Most of us will acquire at least one STI in our life. 1 in 2 sexually active young people will get an STI by the age of 25. Most will not know it. Again, here goes me stressing the importance of making sure that you're getting tested every 3 months, because most will not know. Next myth: I would always know if I have an STI. We just talked about that. So most don't know. So with that being said, you may have no symptoms at all and have an STI without knowing it. The signs and symptoms of STIs are very mild and may appear weeks or months after being infected. Even if you've used protection in the past, no method of protected sex is 100% safe. To prevent the spread of STIs and reduce the risk of catching an STI, use condoms and have regular STI checks. Next myth: all STIs are curable. So we spoke about that from jump. That's when I said that STIs and STDs are 2 terms that are used interchangeably. So not all STIs are curable. STIs that are caused by bacterial infection, once diagnosed, can generally be treated and cured. However, viral infections such as HSV, which is herpes simplex virus, HPV, which is human papilloma And HIV, which is, of course, human immunodeficiency virus, can only be managed, not cured. Those would also classify under the STDs. All of those begin with H, if you heard. All right, next myth. I had unprotected sex. I feel fine, so I must be fine. Again, symptoms of many STIs may take days, weeks, or even longer to present, and many may never cause symptoms, i.e., chlamydia. Testing for all STIs after having unprotected sex is important. Myth number 10. An STI check includes tests for all STIs. So, that's untrue. Fact is, an STI check tests for the most common bacterial STIs, which for us here at Whitman-Walker Health are chlamydia and gonorrhea. I'm going to go out on a limb and say for most places that offer free testing within the DMV area, it will be chlamydia and gonorrhea. Those are the two those are the two, when you go in and you ask for STI testing, those are going to be the two staple. Now, herpes, HPV, and HIV are caused by viruses and are not routinely tested for unless symptoms are present. Or you come in and say, I've had contact. Someone contacted me and said that they were positive, and I've had contact with them, so I'm coming in to get tested. Ask what your STI check includes and does not include. An HIV test is not included automatically, but can be done if requested. So we also, we push for HIV testing, of course, obviously, but we also don't, it's not included automatically. If you say STI, we'll say, okay, we test for chlamydia, gonorrhea. We also test for syphilis. That is a blood draw. But you also would have to mention, I would also like HIV testing. If you need more expansive testing than that, like for herpes, because we do not test for herpes unless somebody says that they have symptoms, you can go to DC Health and Wellness. That is located at 77 P Street Northeast. Their hours of operation are pretty much like ours, Monday through Wednesday and Friday. They're 9 a.m. to 2:30 p.m. They lock the doors at 2:30. And on Thursday, they are 9 a.m. to 11:30. I would say 11 because they close at 11:30. So I would say 11. So yeah, if you need more testing than the chlamydia, gonorrhea, DC Health and Wellness is your place to go. Next myth. I am only likely to get one STI at a time. That's a big myth. And I got big facts for you. So it is not uncommon to have more than one STI at a time. We call that co-infection or dual infection. So if you have chlamydia, you can absolutely have gonorrhea at the same time. Or if you have gonorrhea, you can absolutely have chlamydia at the same time. Some places, even if you are positive for one, they'll actually treat you for both. Some places will, not all. But like I was saying, it is not uncommon to have more than one STI at a time. Infections with most STIs increases the risk of getting co-infection with HIV. HIV positive people with other STIs can transmit HIV more easily to partners. Next myth, we're almost done. Next myth, I've had chlamydia twice, so I must be infertile. So like I said, having STIs that go untreated for a really long time, the risks is that you can become infertile or sterile. So risk of infertility increases with repeated infections of chlamydia or gonorrhea, but does not guarantee infertility. Regular testing and early effective treatment will reduce the chances of infertility. Again, I cannot stress enough, if you are sexually active, especially if you are having sex unprotected or with multiple partners, it is very, very important to get tested every 3 months. Every time you change a partner. Every time you have a new partner and you think you're about to start having sex, get tested first, okay? Next myth, I am on the pill, so I am protected. So the pill is basically birth control, right? That's one form of it. There's also NuvaRing. There's Eplenon, which is the implant that goes like right up underneath, almost underneath your arm. And there are various IUDs, intrauterine devices. So there's the actual traditional pill and then all of those options as well. However, none of those options, not the pill, not the IUD, not the implant, not the NuvaRing, not the patch, none of those will protect you from STIs or STDs. They only protect against pregnancy. That is it. What else? Next myth. I gave a urine sample to the nurse and it came back negative for chlamydia, so I must be okay. Again, when you go for an STI check, you need to figure out what they're offering. Again, I said in the DMV area, the staple is chlamydia and gonorrhea. So usually if you're getting tested for chlamydia, they will also test you for gonorrhea. But you should still inquire because you should want to know what you're getting tested for. But it is possible to have another different STI. So you need a full sexual health check to make sure that you're okay. So if you're testing for chlamydia, they mention to you that it's only for chlamydia, ask them to also test for gonorrhea. They can absolutely do it with the same sample. You don't have to come back another day and give another sample. They can use the same exact sample. And we've come up on our last myth, and it is, I shared my boyfriend's STI antibiotic pills. Therefore, I don't need to go for a checkup. So, also heard this a million times, and there's so many things wrong with this. First and foremost, do not take any medication that is not prescribed to you, that did not come with a written order from the doctor or that your doctor sent over to CVS for you to pick up with your name on the bottle. If your name is not on the bottle, do not take anybody's medication because it's specifically for that person. I'm not talking about like Tylenol or ibuprofen, right? That's regular. You can get that over the counter. That's different. Any medication that is prescribed is for the person it was prescribed for. Okay? That's one. Also, if you're sharing the medication, that means your boyfriend or partner, whoever, is not getting the full prescription. So, or not getting the full dose. So, is the medication really working for him or her or them? And then you've only taken the other half of the dose. So is the medication working for you? Like full dose. So different STIs. Also, this is the thing. Different STIs need different types of treatments. A prescription of antibiotics needs to be taken in full by the person they were prescribed for, or the infection may not be cured. It is a risk sharing pills that are not prescribed specifically for you by a health profession. Please do not be taking somebody else's medication. That's absolutely not safe. Even if you know that it's specifically for chlamydia and you also tested positive for chlamydia, but you have not went to pick up your medication or whatever, or your boyfriend's prescription was 2 pills, so you took one and he took one. It doesn't work like that. You need the full dose to be treated. So that was my last myth. I didn't see any getting dropped in the chats. So few more public service announcements and then we'll be outie. So Whitman-Walker Health has COVID-19 vaccines available. Everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine, and everyone ages 16 and up are eligible to receive a COVID-19, the Moderna, vaccine. Please reach out to us at 202-207-2480 to make an appointment. We do not have, I know what I just read to you, but I just want you to know, we here at Whitman-Walker Health do not have the Pfizer vaccine. We have Moderna and Johnson & Johnson. So that is important. If you're specific on the vaccine that you would like to have, just keep in mind that we do not have Pfizer. We only have Moderna and Johnson & Johnson, but you're still absolutely welcome to make an appointment to get vaccinated with us. For DC residents, you can find more information on walk-up locations if you happen to not be able to make our hours, and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. For Maryland residents, learn more about the Maryland vaccination distribution process and schedule an appointment through covidlink.maryland.gov or by calling 855-634-6829. If you live in PG County, you can visit their vaccination registration portal. If you live in Montgomery County, you can visit their vaccination registration portal. And for Virginia residents, you can find out about their distribution process through vaccinate.virginia.gov. That is all I have for now. I see folks joining, but I'm all done. We were talking about myths and facts about STIs. However, if you have like a myth that you've heard recently, you can drop it in the chat real quick and we'll try to fact check it. I see you. Okay, big booster energy. I know that's right. That was a live that was done yesterday. If you missed it, you can check it out on the page. It is absolutely on the page for you to see. Our one and only Crochet Kingpin and Hannah talked about their boosters and how that went. Yeah, you missed the myths. It's okay. I'm sure they were myths that you've heard time and time again. Crochet Kingpin, are you doing a part 2 of the booster and how you're feeling? I still have to schedule mine. Anyone else have myths? Go ahead and drop them in the chat. Whenever y'all want. Oh, perfect. I'll text you later on this week then. But that's all I have for now because I don't see any myths in the chat. So no, nothing to fact check. Oh, good to know. Which one is it? Do you know? Is it Moderna? Is it Pfizer? I'm also looking for a specific one. So all three. Johnson & Johnson's booster got approved. But that's what's up. Good to know. On the 18th of this month, correct? On the 18th of November or 18th of December? Wow. Thanks for the info. Oh, let me just repeat it since I am reading in the chat. So there is an event going on. While I'm saying this, Dwayne, can you put extra information? Yes. So there's an event going on November 18th where we are providing boosters. They have all three. Dwayne says they have all three So that's Johnson & Johnson, Moderna, and Pfizer. So if you need to get your booster, if you need to walk up, that will happen. He will be sending me the information, so I will disseminate that information to you once I get it. But that's it for now. Talk to you later. Bye.